So, hi everyone, this is Dr. Abrelin, and first of all, a very big thanks to all for liking the previous video on black fungus. I hope I could make you understand in a small and short video. Uh, Thank you very much for liking it, and I'll try to update you with such topics more about general health, your dental health, and as well as your overall do's and don'ts and proper take caring of yourself and during this COVID times. So today our topic would be a bit different, but it will be related to COVID, and it is RT-PCR. What is an RT-PCR and how it is done? What is the CT value, and what do we conclude from a CT value? So here it is. Is RT-PCR. See, I'll give you a very easy example. Our body is formed of DNA, and coronavirus is an RNA virus. Okay, now we can study our DNA. Our scientists can study our DNA. Based on that, like we check paternity proof by checking our DNA. Okay, if it matches with our father's, the son's, the DNA matches, is the paternity proof. But in case of a coronavirus, it is a RNA virus, that is a single stranded virus. Just as suppose it's a single stranded virus, and in case of DNA it's a double stranded. So these are two things, and they are two strands, and they make a DNA, and this is a single stranded RNA. So our scientists, our techniques are based on making from DNA to RNA. Breaking this double stranded into single strands is transcription. This process is, this breaking is known as transcription. And here we are doing what? From single we are adding another single and making DNA, so it becomes reverse transcription. From DNA to RNA, it is simple, it is transcription, but since corona is a RNA virus, we can't do this, so it's a reverse transcription. So that's why the test name is reverse transcription polymerase chain reaction. These are made of polymerase chains, and so the name comes. So many people might tell you it's real-time PCR, the test name. These are all wrong information. It is reverse transcription. Now, in the chain reaction, as I said, we after once we're doing the testing, there are some amount of chains that is to be found, that is to be made to locate coronavirus, and the value taken is 35. So for instance, in a total strand of the DNA up till 35, the scientists are checking where your coronavirus is located. From 0 to 35, just count from 1 to 35 where corona is located. The sooner it is located, the more is the infection that time. Okay, and the later it is, the better it is. You have the more chances of getting uh, negative. So once you are close to 35, okay, so your infection at that point of time when the test was done is on a lower side. Okay, so it is always the CT value that is being given is based on this, that where on which number from 1 to 35 the coronavirus can be located. So for example, you a patient's coronavirus is being located in 10, and a patient's coronavirus is located in 30. The patient who is in 30 is obviously in a much better state than in the patient for 10. And there is a very big thing, like once you are getting a result, you're checking the CT value. You must know the CT value, because your positive or negative is secondary, but the first thing is the CT value. Okay, suppose your CT value has come 40, and fine, you are negative, well and good, but your CT value is like close to like 30. Okay, that means the virus is there, but it is in the slightly later chain reaction they have located. That means it's not that much severe till now. But what happens is, see, this it's a very logical thing. Once the virus has affected our body, okay, from the start, when it is started, I am having my symptoms, I just did a test, that time the chain reaction they have got coronavirus maybe at 30. Okay, but once the coronavirus is inside our system, it will replicate very fast. We all know that it replicates like hell. And once it is replicating in huge number in the till the middle intermediate period, if you do the test, this 30 might come to 10. Because when it was in the beginning time, when the virus has just entered your system, they have got the virus while doing the reverse transcription test on the 30, where the value is taken as 1 to 35. Now when the infection has spread, when the corona has multiplied n number of times, the value is at that time can be 5 or 10, if not properly medicated by that time. That's a separate issue. Until again during the end period, after maybe 14 or 20 days, your this ct value, if checked, can be seen again it has delayed. So from the starting, the ct value can deteriorate during your intermediate time, and during the end stage the ct value might again increase. So the ct value is inversely proportional to the viral load. So the more the viral load, the ct value would be reduced. The lower the viral load, the ct value would be more. There are few chances of getting wrong ct value as well. And these days there are multiple reports of false negative RT-PCR reports. Okay, and those are like, if the swab is not taken properly or deep enough, then the collection has been inefficient, then the ct value might come much higher. Because see, the main harbor of corona, that is our throat and our nose. Okay, and when the swab is being taken, suppose they are not getting to go into the depth by whatever means, that time your ct value might come higher. Okay, because then at that time it is very difficult to locate the corona, as I already explained, from your that dna strand, and they are coming at later numbers, 25, 30 or more. So another problem these days are happening is maybe insufficient, like wrong way of method of traveling the test sample. It during travel, it might be getting like distorted. So these are chances where your ct value might differ, and you might get a false sense of safety that I'm fine. So because symptomless patients are so many around us. So the point here is making this statement or making this video. The point is, whatever is the report is coming, once if you are suspecting any kind of symptom related to COVID, isolate yourself as fast as possible. Because once if you have isolated yourself, then there are least chances of spreading it. Okay, then you can do your RT-PCR test if required. If your doctor tells you to do, you do it. Get yourself tested, and you will get to know your condition. Monitor yourself with a pulse oximeter and your temperature. Monitoring is the best way of keeping a check of your health when you are at your home. Okay, any value lower than 94 is alarming. Try to talk to your doctor, and if required, go for hospital administration if your value is coming below 94. Till then, you are good, you are fine. Okay, don't panic. First thing, you are getting some kind of suspicion of COVID, you might say that I had an ice cream last night, so I'm having a sore throat. No, please isolate yourself, check yourself, monitor your oxygen levels, check your temperature. The small easy steps can actually stop the spread of the virus, and then you can do the test. So that was the whole point of making this video, to give you a short insight about how RT-PCR works and what is the inference from the CT value that we get, and how much reliable it can be. At times it can give false negative tests, but we should not get complacent, and we should monitor ourselves, again I'm saying. And there are few small recovery methods if you are in home isolation. Most of us know, but still later maybe I like to make a video about it. Write it down in the comments if you want to know some other topics, if you want to know something else related to COVID or any other healthcare questions. If you have, please write it down in the comments. And till then, take care, be safe, follow the guidelines, monitor yourself, do the maintain the protocols, and we can only hope that COVID is going to last only few days and we can get back to our normal life once again. So with that, please take care. Thank you. Bye bye. See you later very soon. Bye.